Imagine waking up in the middle of the night with a tooth throbbing inside your skull. No dentist, no painkillers from a pharmacy, no antibiotics, no x-ray, no numbing injection, just pain. Sharp, deep, pulsing pain that makes it hard to eat, sleep, talk, or think. Today, a toothache is a problem. For ancient humans, it could become a crisis. So, how did ancient humans survive toothaches without dentists? The honest answer is, sometimes they did not. A serious tooth infection could spread, an abscess could swell the face, chewing could become impossible, fever could follow, and without modern treatment, a bad dental infection could become life-threatening. But ancient humans were not helpless. They used what they had: plants, fire, stone tools, chewing sticks, hands, healers, community care, and a lot of endurance. To understand ancient toothaches, we first need to understand ancient teeth. Early hunter-gatherers often had very worn teeth. Their food contained grit from soil, stone tools, and grinding surfaces. They chewed tough meat, fibrous plants, roots, seeds, nuts, and dried foods. This wore teeth down over time. But heavy wear was not the same as modern cavities. In many hunter-gatherer groups, tooth decay may have been less common than in later farming societies. That changed when humans began farming. Agriculture brought more starchy foods: grains, porridges, bread, stored carbohydrates. These foods can feed bacteria in the mouth. Bacteria produce acids that damage tooth enamel. Over time, cavities became more common in many farming populations. So, one of the strange truths of history is that civilization made some tooth problems worse. More settled life brought bread, storage, and cities, but it also brought more dental decay. Still, even before farming, teeth could hurt. A cracked tooth from biting bone or hard seeds, a worn tooth exposing sensitive tissue, a gum infection, an impacted tooth, a jaw injury, a piece of food trapped deep between teeth, a dental abscess. Any of these could cause pain. The first line of defense was probably cleaning. Ancient people did not have modern toothbrushes, but many used simple tools to clean teeth. Chewing sticks were one of the oldest and most widespread methods. A person could take a twig from a suitable plant, chew one end until it frayed, and use it like a brush. The fibers scraped the teeth. Some plants also had pleasant smells, or natural compounds that may have helped the mouth feel cleaner. People may also have used fingers, cloth, fibers, grasses, bones, or small sticks to remove food. This was not modern dentistry, but it was not nothing. Removing trapped food can reduce irritation. Cleaning the teeth and gums can slow problems. Rinsing with water may help wash away debris. Some ancient cultures later used powders made from ash, crushed shells, charcoal, salt, herbs, or minerals to scrub teeth. Some of those substances may have been too abrasive, but they show that people cared about oral hygiene. When pain started, ancient humans likely turned to plants. Many plants can numb, soothe, reduce inflammation, or distract from pain. Different regions had different remedies. People might choose certain leaves, roots, bark, seeds, or resins. They might pack plant material near the painful tooth. They might rinse with herbal mixtures. They might use honey, oils, or fermented liquids in later societies. Some plants contain compounds that affect pain or infection. For example, clove oil became famous in later traditional dentistry because it contains eugenol, a natural numbing compound. Willow bark contains compounds related to aspirin. Many resins have antimicrobial properties. Ancient people did not understand chemistry in modern terms, but they understood experience. If a certain bark eased pain, they remembered. If a resin reduced swelling, they used it again. If a plant made things worse, they avoided it. This kind of medicine grew from observation. But pain relief was limited. A plant might dull the ache. It might reduce swelling a little. It might help someone sleep. But if the tooth was infected, cracked, or dying, the problem remained. Then came more direct methods. If a tooth was loose, rotten, or causing unbearable pain, someone might try to remove it. Tooth extraction is ancient. But before Before modern anesthesia, it was brutal. A healer, relative, or strong-handed person might grip the tooth with fingers, cloth, a tool, or later metal instruments. They might rock it back and forth, pull, twist, force it out. The pain would be intense, the risk would be serious, the tooth could break, the jaw could be injured, bleeding could follow, infection could worsen. But if the tooth was already badly diseased, removing it might be the only chance. Sometimes the body did the work slowly. A severely infected tooth could loosen over time. Gum disease could cause teeth to fall out. That was not good, but it could end one source of pain. Ancient survival often meant accepting damage because there was no better option. There is also evidence from ancient societies of dental drilling and treatment. In some prehistoric and ancient populations, researchers have found teeth with drilled holes, likely attempts to treat decay or relieve pain. That means some ancient people were doing something close to dentistry long before modern dental offices. They used stone tools, bow drills, or other instruments to remove decayed material. Imagine the courage that took. A painful tooth, a small, sharp tool, no modern anesthetic, someone trying to drill into decay by hand. It sounds terrifying, but if the alternative was constant pain or infection, people tried. Ancient healers may also have drained abscesses when swelling appeared. If pus built up in the gum or jaw, releasing pressure could reduce pain temporarily. This might happen naturally when an abscess burst, or someone might lance it with a sharp tool. Again, the risks were serious, but pressure from an abscess can be unbearable. Even partial relief would matter. Food choices also changed during tooth pain. A person with a bad tooth might avoid hard foods. They might eat softer, cooked foods, porridge, broth, soft roots, cooked meat cut small, mashed plants, soups, milk, or fermented drinks in some later societies. This is where community care mattered. A person with severe tooth pain may not be able to chew. If they lived alone, that could become deadly. But humans lived in groups. Others could cook food softer, chew, or process food for children, elders, or sick people. Share meals. Protect someone who could not work. This care was one of humanity's quiet survival tools. A lion with broken teeth starves. A human with broken teeth might be fed. That difference matters. There is archaeological evidence that some ancient humans and human relatives survived serious injuries and disabilities for years. This suggests care within groups. Dental problems would have been part of that reality. An older person with missing teeth could still survive if others helped prepare food. And elders still had value. They carried memory. They knew routes, plants, seasons, stories, dangers, and skills. Keeping them alive helped the group. Toothaches also affected sleep. A throbbing tooth often gets worse at night. Lying down can increase pressure. Cold air can trigger sensitivity. Pain can make a person restless, irritable, and exhausted. Ancient people may have sat upright, held warm or cool materials to the jaw, rinsed, chewed plant medicine, or stayed close to fire for comfort. They may have used rhythm, chanting, touch, or distraction. Pain is not only physical, it is emotional. Having others nearby can help a person endure it. Ritual and belief also played a role. Many ancient societies explained illness through spirits, curses, imbalance, worms, divine displeasure, or invisible forces. Tooth decay in some cultures was later blamed on a toothworm. That idea was wrong scientifically, but it made sense to people seeing holes in teeth and feeling something eating from inside. Treatments could include charms, prayers, spells, amulets, or ritual actions alongside practical remedies. We should not laugh at this. When pain is terrifying and invisible, humans reach for meaning. And sometimes ritual helped psychologically, even when it did not cure the tooth. The mouth is deeply connected to survival. Teeth are tools. They cut, crush, grind, hold, and process food. Before knives became common, before cooking was reliable everywhere, before soft diets, teeth were essential equipment. A damaged tooth was not just discomfort, it threatened nutrition. A jaw infection threatened life. Missing teeth changed speech and eating. Dental health shaped daily survival. That is why ancient humans probably took tooth pain seriously. They may not have had dentists in the modern sense, but many societies developed specialists or healers who understood the mouth better than others. In ancient Egypt, there were medical practitioners who dealt with different parts of the body, and dental conditions were recognized. In other ancient cultures, healers, barbers, shamans, or skilled elders may have performed extractions or applied remedies. Over time, dental care became more specialized. But for most of deep prehistory, treatment was local, practical, and painful. So how did ancient humans survive toothaches? They cleaned their teeth with sticks, fibers, rinses, and scrapers. They used plants to reduce pain. They changed their diet when chewing became hard. They drained swelling when possible. They pulled teeth when they had no other choice. They relied on healers, family, and community. They endured. And sometimes they died. That last part is important. Ancient life was not full of easy, natural solutions. Nature could be harsh. A simple infection that modern medicine can treat might kill someone in the past. A toothache could become fever. Fever could become weakness. Weakness could mean no hunting, no gathering, no walking, no survival. This is why modern dentistry is such a miracle. A filling, cleaning, x-ray, antibiotic, root canal, or extraction with anesthesia may feel ordinary now, but compared with ancient history, it is extraordinary. For ancient humans, a toothache was a battle fought with whatever the earth provided. A twig, a bitter root, a hot stone, a sharp tool, a helping hand, a shared bowl of soft food, a night by the fire. The story of ancient toothaches is painful, but it also shows something powerful. Humans survived not because they never suffered. They survived because they learned how to respond to suffering. They experimented. They remembered. They cared for each other. They turned plants into medicine, stone into tools, and pain into knowledge. And sometimes survival began with the simplest act of all. Someone in pain opened their mouth, and someone else tried to help.